In this tutorial, I'm going to teach you how to use the Pocket RX app. After downloading, you're just going to want to go ahead and click on the icon on your iPad, and I am circling it right now, and it looks just like this. It's the little RX. When you open the app, this is the home screen you're going to see. You're going to have the options on your left-hand side over there with the search feature, the med check, and the med box. I'm going to talk to you about the search feature first. So what you're going to see, you're going to have options at the top, along with a lot of medications listed down the right-hand side there. So what you can do is you can either use searching by drug, by class, or by indications, which would just be a certain condition that the patient may have. So I'm going to go ahead and start just by going through searching for a drug. So I typed into the search bar warfarin, which is the drug for anticoagulation therapy for patients with blood disorders. So you can see that the search results comes up with the main drug that I typed in, as well as any brand names that may be associated with this certain drug. So what you want to do is go ahead and click on the warfarin thing there. And after clicking on the drug that you selected, it comes up with a home page for the drug, and it gives you the drug category and class, the indications, max dosage and adjustments, any precautions there may be, interactions with other drugs. And it also gives you side effects, online resources, drug strengths, and an option to add a note about the drug or the patient that you're giving. Okay, so next I'm going to talk to you about the med check feature. So if you go back to the home screen that we initially came to, you'll find the med check option right here on your right hand side of the screen, and you just want to go ahead and click med check there. So what this feature allows you to do is to add in certain medications that you may be considering giving to a patient, or medications that a patient may already be taking, to see if there's any contraindications to giving these medications together, or if there's any additional side effects you need to be worried about. So what you want to do is you want to click this little plus button right up here in the top right hand corner, and that allows you to go and enter in the medications that you want to give, and then it'll add them into the med check list. And then once you're done with that, you want to just go ahead and hit Run Med Check, this blue button right up here in the corner. And once you hit Run Med Check, you'll get a little pop-up Med Check results chart with interactions with the drugs, precautions, and side effects. And so if you want to look at the individual reports, you just want to go ahead and click on the individual categories. So I had added in aspirin, azithromycin, and warfarin to this patient's med check, and you can see that there is one interaction between the two drugs, between azithromycin and warfarin, that says if azithromycin must be used with warfarin, you need to check their INR and their bleeding parameters as much as you can. And then if you click back and then you click on the precautions, there is a precaution when you're giving aspirin and warfarin at the same time, which is an increased bleeding risk. This is because these drugs are both used for treating blood disorders and blood clotting. So you want to take note of that. And then finally, it lists the side effects between these three drugs. If there's any sort of increase in side effects you may be seeing, and there is nausea and vomiting associated with aspirin and azithromycin. Not a whole lot, but just a little bit. So you do want to take note of that and make sure your patient is aware. So the last feature they have is the MedBox feature, which is basically just a feature that you can use for patients or yourself to keep track of drugs that are certain patients taking, and if there's any certain schedule they need to keep track of. So what you do for that one is you just create an account, and it allows you to enter all your medications, when you're supposed to be taking them, your dosages, stuff like that, just to keep track of your medications. So finally, I think the Pocket RX app is a great resource for anyone, any clinician who may be either administering drugs or prescribing drugs or monitoring the drugs of a certain patient, just because it allows you to see any interactions that these drugs may be having together, any different side effects that may be happening that may be causing your patient to experience certain symptoms that you want to take care of. So it really is a good resource for not just doctors, but nurses, obviously pharmacists, and any other healthcare professionals to use in the field when treating patients.